Today's podcast has been sponsored by Apricity. If you're trying to conceive, imagine a world where fertility care is free of stigma, full of support and tailored just for you. With Apricity Fertility, that world is closer than you think. Apricity's virtual fertility clinic makes care accessible and personal. From at-home diagnostic testing to virtual consultations and expert treatment like IVF and egg freezing, they're redefining fertility care. Plus, their success rates surpass the UK national average, giving you even more hope on your journey. With the Apricity app and your own personal advisor, you're supported every step of the way, 7 days a week. Apricity understands that building a family shouldn't mean putting your life on hold. Visit www.apricityfertility.com today. Apricity, fertility care for the modern woman. Hello and welcome back to Outspoken, the podcast from Femme Health. Thank you all for listening today. I can't actually remember what week we're on. I think 5 or 6. We actually have 5 podcasts this week. We have had so much great feedback from it and loads of people wanted to join us. So thank you so much. If you are not following us, please do. It means the world to us. So let's get going. Today, we are so excited to be joined from Kayleigh from the Fertility Mapper. Huge welcome, Kayleigh.
Hi, and great. Thank you so much for having me.
No, thank you for joining us. Really exciting for us, really, because we have been one of the first, I suppose, e-commerce to have your widget and your information on our website. So really excited to speak to you today.
Yeah, and thank you so much. It's so great to be able to get the information to people who need it. So really appreciate the collaboration.
Amazing. So just tell us, Kayleigh, who are you and sort of what was your route to the Fertility Mapper before the launch, I suppose?
A great and slightly existential question. So who am I? I'm the founder of Fertility Mapper. And my background is really in healthcare. I've worked in healthcare for probably about 18 years now. I studied the biology of fertility and embryo development many, many years ago, before it was even possible to do egg freezing.
Wow.
I was going to go into clinical embryology, but I took a year out and ended up working for a politician on their healthcare portfolio. I got really interested in how to improve population health and how do you improve access to healthcare. So rather than going back to medicine, which was the original plan, I then spent the best part of 10 or so years working on funding and access to healthcare services across different things, not really related to fertility or women's health, but areas like adult social care. I worked for a long time on mental health. So back then there was no access to talking therapies, and so worked within the NHS and the Department of Health to help roll that out, and various other things. So worked kind of within the Department of Health for a long time. I then started to notice that there had been a kind of big shift in fertility coverage from the NHS covering quite a large proportion of fertility services to increasingly reducing the amount of coverage it was giving to people. And so I saw this big shift where people went from being solely patients to being patients and customers of extremely expensive services.
Yeah.
And you know, for many of us, I don't know about you, but it's probably when people kind of access fertility, it's probably the first time they've ever had to pay for healthcare. And it's an absolute minefield. And so what I saw was people were really struggling. They were struggling because they were, patients. There were people who were experiencing, questions of their fertility. And then on top of this, they had this huge kind of administrative, financial burden that they were trying to understand and work their way through with at that time, literally no information on how much stuff should cost, what high quality clinic experience would look like, etc. And so based on my background of working on funding and access, it seemed like and the fact that a very, very long time before I'd been working on clinical embryology, it felt like a place where I could help. And so that was really the beginning of Fertility Mapper and why I kind of started the business.
Wow. Wow, that's some impressive stuff. And so is it a personal journey to you? Did you have a fertility journey yourself, or did you have friends or family that were struggling like how did it sort of evolve?
Yeah, so also such a good question. So was it a personal journey? I think the answer is yes, and in so many ways. So I think one of the things that we don't really talk about when we talk about fertility is 1 in 6 people struggle with questions of fertility or issues with self-fertility globally. And so that means that if you're in a coffee shop, there are several people in that coffee shop who are struggling with questions of fertility. That is a lot of people. And
Yeah.
yet, when we talk about it, we kind of think of it as this sort of area where maybe it's a sort of secret. No one else is going through it. There's something wrong with me. Um, I'm different from everybody else. But the reality is, so many of us um, are going through, are thinking about treatment, or are kind of trying different things to support their fertility. And
Yeah.
so when I started the business, it was very much personal in the sense that because I had this knowledge, um, every all of my friends would come and ask me, which clinic should I go to? How much should I be paying? What is safe? What isn't safe? What kind of options are available to me? So it was one of those situations where you couldn't really go. You couldn't really go to a dinner party without someone kind of coming up to you on the sidelines and asking.
Yeah.
So kind of seeing people go through that process was such an important part of the reason that I started it. And then
Amazing.
Oh, sorry. And subsequently, I've also been through several rounds myself of egg freezing. And so
Yeah.
it's kind of one of those things that has come, full circle. I've seen it both academically in a professional context and then also through friends. And then I've been on my own journey as well.
Amazing. So was there an element of like safeguarding people that made your decision to make the Fertility Mapper? Because obviously the IVF industry has become, like you said, this huge money making industry with a lot of the costs actually not disclosed at first. So has there been an element of sort of, yes, okay, we all need clarity, that's fair, that's choice, we all, that's just the respect we all as women and men deserve. But do you think that it just became out of hand? The amount that they were charging and the hidden sort of costs?
So was there an element of safeguarding? So it was very much a case of, I think we think about kind of physical well-being, and we think about now more than we used to emotional well-being when it comes to healthcare. But we've never really talked about financial well-being,
Yeah.
and it has such a big impact on both your treatment, but also then subsequently what happens afterwards. So when you
Yeah.
start a family having invested in fertility treatment, you're starting in many cases 10, 20, 30K less well off than
Yeah.
before you started fertility treatment. So it was very much about supporting people who are, many of us who go through fertility treatment are extremely impressive people in every other aspect of our life. And then when it comes to fertility, it's sort of one of those things that starts to take your power away. And so for me, it was very much about how do you give people their power back? How do you give them that control over their experience and make them feel powerful? And so that's kind of one of the really important things that we've focused on. And then the other thing for us, it's all of everything starts with creating transparency. So we could have, when we talk to Stef about safeguarding, just sort of set something up where we guide people through the process, but without first driving transparency, you're kind of you're kind of owning that journey for someone else, but that still doesn't really give them your power back, if that makes sense. So for us, it was first about how do we drive huge transparency so that people feel like they can get access to the information they need and feel like they're in control
Yeah.
at the beginning of their process.
Yeah, which is so powerful, I think, for women, couples, men, on a fertility journey, because you don't have any real control, of the outcome of your fertility treatment. So, just to have the control on the transparency of the financial side of it, it's very powerful. And I just think it's sort of the basics, but I speak to so many people since we launched Femme, and they were like, yeah, we had 10,000, it ended up costing 30, there was this, there was that. Had no clue that this was all sort of coming out the woodworks. And then I suppose once you're in a cycle, you go into another one, and sort of where does that stop?
Yeah, very much so. I mean, that's something that we hear a lot. And it's actually, so we obviously we drive great transparency around the cost. So for people who don't know us, we're a review site for fertility clinics. And we have totally transparent costs by clinic, but we also collect feedback on experience, which is the other part of the kind of coin. So it's both, the cost related piece and then the experience that you had in that clinic. And the kind of connection, I guess, to what you're saying is that when we think about costs, we think about the actual amount you spend, but there's also this point about cost transparency. So one of the things that we measure at fertility clinics as part of our experience feedback is we ask the question, how transparent was your clinic about the costs? And that's actually quite interesting because if both you and I went to the same clinic, we would naturally spend a different amount of money because your underlying biology and the services you need is different to my underlying biology and the services I need. And so naturally what it might cost me might look different from what it would cost you at the same clinic. But the
Yeah.
key point is this question of transparency. So, for example, did the clinic give you a fully costed treatment plan before you started treatment? So if both you and I went to the same clinic, we might spend different amounts because we have different needs. But did we know at the beginning what that cost would be at that clinic? And so that's
Yeah.
why this kind of question of transparency and experience is so important.
So how have the clinics responded to this?
Actually, really well. And so I did wonder. I was running another company, a digital healthcare company, before I started Fertility Mapper. And Fertility Mapper was something I was building as a passion project on the side. And as with any of these things, it's one of those things that slowly starts to take over. And at some point, you kind of have to, you can't keep
Yeah.
doing both. And so that's why I decided to come and start Fertility Mapper full time just over a year ago. And kind of through that process, we did quite a lot around transparency. So we did a piece with the Telegraph about a year ago, driving transparency on cost. And then we also did a big piece with the Sunday Times Money in November, which again kind of talked about this issue of the true cost of fertility. So the difference between what's advertised and what you actually pay. And I was expecting that we might get maybe some negative feedback. But actually, what's been really interesting is a lot of the clinics we've spoken to have been very positive about what we're doing. And in some ways, because don't, they don't, they don't know how to necessarily always how to set their pricing. And so having kind of information on, feedback around some of the transparency points that we've talked about is actually enabling them to change the way they do things to make things better. And so there's kind of, there's always been a mixed bag, but what was interesting to me was actually we've had quite positive feedback from both people who are using the service, but also
From the clinics as well. Incredible. So if an individual comes to the Fertility Mapper today, what can they do? Because there's a couple of things that you can currently do on the website.
Exactly. So we're all about access. So we have a range of tools that support people to understand how they access services. So the first tool, if we start at the beginning, that we have is we have a calculator that helps to tell you if you're eligible for NHS-funded fertility treatment. So in the UK, the NHS funds just below 30% of all IVF cycles or fertility treatment. And whether or not you're eligible or not is determined by your postcode, what is kind of known in the media as the postcode lottery. But also, we call it a personal lottery because it's a number of things that relate to you, like if you've had children from a previous relationship or your BMI might dictate whether or not you're eligible for funding or not. So on the calculator, we've collected all of this data across all of the local areas and then put it into an algorithm. And so if you kind of fill in the details in the calculator, we can tell you very quickly if you're eligible for NHS funded treatment. And that's actually the tool that you mentioned, Stef, which we're really happy to partner with you on, and is on Fem's House website. So that's kind of the first thing we do. And then the
And
second thing,
I will just say, Kayleigh, on that point of view, on that point, sorry, we actually have had feedback that people, and you've probably had the same, are moving house depending on the amount of funding they can actually get.
yes,
In
so
certain areas, they're actually moving house because they can maybe get one round where they currently are, and they're now finding out where they can get maybe 2-3 rounds, and they're actually moving house. Like, that really shocked me.
yeah, it's amazing actually. But you're right. And the thing that's quite interesting is, so if you look in an urban, this is specific to an urban area, where there might be several geographical boundaries that define access within one city. If you move from one postcode to the other postcode, and it can be like literally 3 streets,
Yeah.
um, that can change what you're eligible for quite dramatically. And so that's actually why we built the calculator, is because people are making huge decisions off the back of kind of whether or not they think they can get coverage or not. So it's extremely important to make sure they have the most up-to-date information in order to
Yeah.
inform that. But yeah, it's wild. And when you look at the kind of average cost of a cycle of IVF and think that most people go through 3 rounds, that's the average. It really starts to add up quite quickly. So it's sort of understandable that people might kind of think about moving house in order to get access.
Yeah. I mean, what are your personal thoughts on the postcode lottery? Like, obviously, the money is allocated and then it is down, it's split depending on the needs of the area. But like you said, that can sometimes change 3 streets down. So you sort of start thinking, how is that fair? How can that change in such a close proximity in the area? Do you think the way we're doing it is fair? What changes would you like to see?
Yeah, I mean, again, it's not fair. I think it's fairly on the face of it, it is not fair. And I think it's really important to examine why we got here in order to understand what we should do about it. And so, if we look at why we got here, it's because fertility treatment is considered in the UK a healthcare topic. So, what happens is it's funded by the NHS. And then in the NHS, the decisions about what is or is not paid for are not made at a national level. So they're not made by some person sat in London or in Whitehall. They're made on a regional level. And so these regional, what are called NHS payers or something called an ICB, get a pot of money, and they decide for their population what they do and do not fund. And so what happens is there's a limited pot of money, and there's huge demand. We see it everywhere for healthcare services with an aging population and increasing issues of kind of ill health, so underlying long-term conditions. And so the demand on that pot of money right now is significant. And so
Yeah.
these kind of local NHS payers are sort of left with having to decide what they do and do not fund within that limited pot of money. And really, unfortunately, fertility often ends up at the bottom of the list after they've like allocated funding to everything else. And so that's kind of why you see these postcodes, is because you've got people in local areas who are making decisions about what to buy, what things to buy, what healthcare things to buy, and fertility kind of drops through the net depending on whether or not that person making that decision or that committee making that decision decide fertility is more or less important relative to funding other types of healthcare. And I think if you look at that, that's kind of wild, because these decisions are being made based on societal factors. So, for example, if you have children from a previous relationship or not. And I think one of the questions we should have is, should local healthcare decision makers decide about access to fertility on the basis of non-healthcare screening criteria?
Yeah.
So I think what we actually really need to do is change this idea of fertility and turn it on its head, um, and perhaps talk about it as a societal topic, not as a healthcare topic. and think about maybe allocating funding in the UK on kind of on a national scale, on as a kind of societal thing, rather than putting that decision into a local area where, in fairness, that poor person has quite a lot of stuff they have to pay for and they need to figure out what they do and do not fund. I think that's partly where the challenge comes.
Yeah. And because I suppose, is there any sort of regulation once that happens? So that money goes there, they decide where it's distributed, and then is there any sort of, I suppose, aftercare to check year on year what's actually happening with fertility in that area? You know, are people getting in more debt? Are the rates, for fertility treatment in that area privately sort of soaring? Like, is there any sort of, I suppose, aftercare?
So, in short, no, is the answer to that. So one of the things that we're doing right now is, as part of the cost report I mentioned that we launched in November, we did the cost on two sides. So we looked at private costs, but we also looked at NHS coverage. So one of the things we're tracking right now is the changes in coverage over time. So we can look at it from that perspective. But what we also know is, for all those wonderful people who are using the calculator, I think there's like a couple of thousand people using the calculator a month right now, we can start to see which areas are kind of covering more or less people. For example, there's a particular ICB that I won't name. Of all the people that have been through the calculator, 0% of them are eligible for treatment.
Oh, wow.
So we're it's something that we're really tracking right now, but in short, there is no current situation where there's aftercare or a kind of mapping of what happens to people when they can't fund the treatment in that region.
Wow. And just on a personal question, I suppose, because we're from a blended family. I have a daughter, my fiance has a son. We don't have a child together. We already know if we did, there'd be a very high potential that there'd be fertility treatment needed. What is the reason that they take into account if you have a child with another partner?
It's really hard to answer that question, because the honest answer is I don't know why a healthcare decision maker would take into account a previous child, because
Yeah.
typically decision making should be based on healthcare criteria, not on societal criteria, let's call it. And so in this case, very much that's, I guess, my question: why is this decision being made by a healthcare payer and not kind of considered on a broader basis?
Yeah.
It's a really tough one. There are some ICBs that will fund you if you have children from a previous relationship. So it's about kind of 20 to 30% of ICBs will fund you if you have children from a previous relationship on either side. So it's not totally, you won't totally be counted out, but of course that means that 70% won't. So it's a really big topic and it's not being discussed.
Yeah. I feel, I mean, this is a whole other podcast, but I feel like it just lends itself to the secondary fertility topic of, oh, well, you should be grateful you've already got one.
I mean, that's essentially the judgment that's being made.
Yes. Yes. Right. Okay. Let's just go back to the Fertility Mapper then. So you can go onto the website to look at the postcode and the amount of funding, but there is something else that you're currently doing as well. If you want to just talk us through that, Kayleigh.
Yeah, absolutely. So as we said, we're all about supporting people to access treatment. So we have the piece that tells you about the NHS side. So there's the calculator we've discussed. We also have guides, by the way, that explain everything we've just discussed. So if you want to get into more detail, you can read our guides and understand what eligibility criteria are, what ICP are, what that means for you. And then for people who don't qualify for NHS-funded treatment, we have a kind of another side of what we do, which is supporting people to understand private costs. And we do that in a number of ways. We do it through the reports that I mentioned, but we also do it through, we have the only or biggest data set in the UK where we have the cost of every single fertility clinic, right down to every potential blood draw that you could have. We know the cost of everything. And so this is obviously an evolving topic, but we try and break that cost down in the best way we can to make it super transparent by clinic. So that's kind of one side of it. And then the other side of it, as I said, we can provide you with the information on cost, but experience matters, and it matters a lot. So most people, as I said, will go through 3 rounds of fertility treatment. Typically, you're not doing those all in 1 year. So people who are going through fertility are on and off doing treatment over several years. And so the clinic that you pick is so important to defining how you feel through that period. And so we also collect reviews of people who've been through fertility treatment. These are generously given by people in the community, and we can't thank them enough. And those reviews are also by clinic. But really importantly, these reviews are not like a Google review where you've got a 5-star rating and a bit of free text. And importantly, Google does not validate its reviews, so anyone can leave a review. We always sort of say, would you review your fertility treatment like an Italian restaurant? I really hope not. And so we spent a lot of time making this as user-friendly as possible. So our reviews are verified. And they also include pre-text, so people can explain in their own words what their experience was like. But we tag those reviews as well. So you will find if a person has polycystic ovaries or endometriosis, they tell us that, and we tag that on the review. The review is totally anonymous, but you can see the person that left that review had this underlying condition, or they were successful or not successful, or also we collect information on how they funded it. So did their friends and family pay for it to help them out? Did they fund it through debt? Did they pay for it out of savings? So we tag all of this information in the reviews. So when you go to a clinic page, you can see this is the cost, but then you can also see this is the experience, and you can really get into detail on, what that means for you specifically. And then finally, we also have a lot of educational resources. So guides on what is IVF, guides on cost and how it breaks down, guides on, what is egg freezing, sperm freezing, all the different topics that you might need information on.
I mean, this is some really, really powerful data. How can it work from clinic side? Will eventually they have like a rating that they can present that they were scored by the Fertility Mapper? Will there be some kind of grading?
Yeah, exactly. So right now, we're collecting the feedback, as I said, and that also generates a grade for the clinic. So they get an overall rating. To keep it simple, it's out of 5. And then they also get rated for key metrics. So we rate them for cost transparency, we rate them for communication, we rate them for providing a really human experience, and then we also rate them for communication, which is a key thing people tell us, which is one of the biggest challenges they face going through treatment is a lack of communication or poor communication. So we rate them on those kind of core topics, and those ratings are generated by the reviews. So anyone who leaves a review, and I would urge you, if you feel that anyone listening feel that they've been through treatment and they want to contribute, then those reviews are basically driving the numbers that people see, and informing kind of people's decisions about which clinics to go through.
Amazing. I did just want to talk to you quickly about IVF treatment when it doesn't end with a baby. So we've been talking about this a lot at Femme over the last few weeks, and sort of the aftercare of that. So I just wanted to sort of understand from the Fertility Mapper's perspective, are you noticing sort of reviews more negative when the outcome wasn't a baby? And are you sort of gaining any feedback or customer understanding, patient understanding of aftercare?
Yeah, really good question. And so it's the reason actually we tag our reviews. When you read the reviews, it says if that person was successful or unsuccessful, because naturally the experience you have is intimately linked with the outcome. It is often difficult to untangle the two. So it's the reason that we ask people to tell us, and it's the reason we flag our reviews. And then the other thing that we've done on the reviews themselves is we ask some very structured questions. so that we can try and separate those two things, which was the outcome from actually how you feel about that, your specific experience, on whether or not, for example, the clinic was good at communication. If you ask very specific questions, it can help sort of separate those two things.
Yeah.
But what we're seeing is naturally there's a bit more of a skew towards, if you had a positive outcome, you feel slightly better about your experience. If you have a negative outcome, you feel slightly worse about your experience. But what we're also seeing is, because we've developed this process, actually people who have had positive, I mean, you can read the reviews, people with positive experience outcomes talk very clearly about some of the failings in their experience and provide very specific feedback on that. And so, you know, they'll say something like, you know, overall we're extremely happy to have had the great outcome, but this was why this didn't work for us and how it felt. And on the other side, we do also have people who were not successful, kind of saying very clearly that they weren't successful, that they couldn't fault the experience at the clinic. And so we are kind of seeing, as the data grows, different trends, but it is, you know, more balanced than you would think it would be. And then on this topic of aftercare, that's absolutely something that we ask about, and it's like a key challenge is, and this again stems back to the core of where fertility comes from, which is as a medical, thinking about it as a medical topic or a clinical topic, is that when people finish treatment, they often kind of they're on a bit of a cliff edge. So they, either way, actually, even if you are successful, you're sort of then left to your own devices when you're unsuccessful. And that's, you know, there's very limited aftercare fairly consistently in every single clinic. And so that's a really big, you know, big challenge for many people who feel extremely vulnerable and are not perhaps in the best place if they're not successful. It's also true, if someone is successful, we also think, okay, great, well done, it worked for you, you must be happy. But actually, a lot of people who are successful then go through a great deal of anxiety whilst they're pregnant, which isn't supported anywhere either, be that in the NHS or through the clinic that they receive treatment. So it's a, you know, really big challenge right now.
Yeah, you're sent on your merry way either way, and I have two very close experience either way. I have a friend who has a 2-year-old from the second round of IVF and is now in the habit of apologising every time she naturally moans or negatively speaks about anything to do with parenting. So if she's had broken sleep, she'll say to me, I'm really sorry, I know I wanted this so much. Mentally, that's alarming to me. I'm like, you feel like you can't be you because you wanted this and you had treatment. And I've spoke to her about this a lot, and I think, you know, where's the aftercare there? And then a very close family, member of mine had 4 rounds of IVF, was not successful, did actually unfortunately have to have an early termination of one of the pregnancies, and still seems to me lost because the fertility journey took over her whole life. She stopped work, she changed her diet, she didn't drink alcohol, she changed every single bit of her life, and then the outcome wasn't a baby, and then she had to rebuild herself, and you know, she's 3 years on now, so we're 7 years from starting a fertility journey, and she's only just rebuilding her career, her friendship circles, and it saddens me to see people like this, and we don't have really any national sort of aftercare for people, regardless of the outcome.
It's such an important topic that often isn't spoken about in 2 ways. One is obviously the mental well-being support that people need, and then the other is that this isn't a process. When people perhaps who haven't been through fertility, or who don't know much about it, think about fertility, they think about sort of IVF as a short-term thing. It's like a month or it's 2 months, and that is your fertility journey. But the reality is, if the fertility journey is, for many, several years, sometimes tens of years of kind of going through, yes, intense periods where you're going through treatment, but that's circumstance called latent period between treatments, where you're not actively engaged with a clinic or going through IVF, but it doesn't turn off, it never goes away. And I think one of the things as well that we do a lot of face to camera sort of Instagram posts where people talk about their fertility journey, and again, amazing people who are really open. Not everyone feels that they want to talk in an open way, which is absolutely fine. But these people who have decided that's what they want to do, one of the people who we speak to regularly said, it fundamentally changed who I was as a person, and I was never the same afterwards. And he was like, it was a positive or negative, but I am a different person now. And so this idea that it's a short process and that is your journey is really one that is not consistent with actually how people feel. And people are going through this process for several years. And so, you're absolutely right. What's the support to help people between those kind of peak intense moments of clinical kind of intervention or clinical treatment, to help them flourish and still continue to live their life in between this process.
Yeah.
It's really
and from what you've said there is an element of before care as well. One of our founders has been very vocal and open to us. She's been on a fertility journey for 6-7 years and will not have IVF because she doesn't want to put her body and her mind and her mental health through it all. So the sort of the decision before as well, and many of us don't talk about the reasons why IVF isn't always the answer, and that could be a personal reason as I don't want to go through that.
Exactly. And I knew that's such an important point as well, which is there are many different ways that people want to tackle or handle this question of fertility or infertility. And the clinic is kind of one road, but there are lots of other things that people try or get involved with that isn't going through fertility treatment. And all of those decisions are personal. I think just the most important thing is that they're evidenced and supported and people are empowered through that process, whether or not it's going through fertility treatment or whether or not it's perhaps changing lifestyle or whatever that individual decides is the right way for them.
Yeah, exactly. I think we're getting better, and the incredible work that you're doing and so many companies are doing and charities, we are getting better, but I think there is still a lot of work to be done. But we take it.
Sorry, and I think that's I didn't mean to talk over you, but I think that's such an important point, which is when I go on a podcast or we write kind of information for the papers, it can be such you always find yourself being so not intentionally negative, because we're in that tipping point where things have been so bad that we're kind of at that moment of change, but there's a lot of stuff that we need to talk about which might not necessarily feel super positive. This topic of access doesn't feel like a positive topic, but it does. We are on the tipping point and more people are raising their voices to talk about their experience and to talk about kind of what's happening in terms of funding and access. And so that for me does feel extremely positive as well. So there's still a very long way to go. I think this momentum that we're experiencing is such an important one, and we just need to keep having these conversations in order to force that change.
Yeah, I couldn't agree more. I really couldn't agree more. And I do think, like I say, people are speaking up more. And I think that if we can take anything from it, that is so powerful, because it is a very lonely and isolated journey, and some have said filled with shame. So if the more we talk about it, the more there's sort of an inclusive approach with it. So I agree with you there that you are definitely right. And I think the more and more things that we do and we say in the community that we build, that will only get stronger, which is great.
Absolutely. Our voice matters.
Yes. So just to finish off, Kayleigh, where can we find you the most? Is it over on Instagram? If people want to learn more about the Fertility Mapper?
Yeah, absolutely. So if you find us on Instagram, you'll find other people who are going through fertility treatment and typically following us. We post information there on costs, and we also post people's stories. And if you feel that you want to leave your story, please let us know. We'll definitely help you, help do that. And then the other place you'll find us is on fertilitymapper.com, and you can Google us and we'll pop up. And on the Fertility Mapper website, you'll find all the reviews that I talked about. So if you're a person that's been through fertility treatment and you want to leave a review, that's where you leave it. If you're a person that's starting treatment that wants to read reviews, that's where you'll find them. And then also that's where you'll find our calculator in addition to on the Femme Health website. And you'll also find all our guides there as well. So, Instagram is where you'll find the usual socials, and then a lot of content, tools and information is on the website.
Amazing. And will you be heading to the fertility show in May?
I will, in fact. Yes, I will. So I'm really excited about seeing people there.
Amazing. We will be there too, so it'll be great to catch up. Thank you so much for your time, Kayleigh. We are so excited that you've joined us here today, and hopefully our listeners can take something powerful away from this, and we can keep moving forward, and sort of helping each other one step at a time.
Perfect. It was lovely to speak to you, and I'm really kind of excited to see what the team are going to do. So it was great to be part of the podcast. Thank you.
Amazing. Thanks, Kayleigh. Bye.